following program contains the opinions of its host and guests, not those of this network. The opinions expressed are for non-commercial informational purposes only. Listeners are cautioned not to rely on program content to treat or prevent disease, but are advised to consult with a licensed healthcare professional where they live for diagnosis and treatment of disease.
And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative. A lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. We also have a couple of our priority lines open. You want to call directly. That's the priority line number is 831-685-1080. Priority number is 831-685-1080. And today I want to talk about, again, pre-existing conditions, the big thing in the news, pre-existing conditions. And I want to speak specifically about birth defects. It covers a lot of territory. And, of course, some can be minor. You have a shortened little finger. Some can be major, like Down syndrome, things like heart defects, cerebral palsy. And it covers a whole range. Anything that has to do with the embryo building based on what the mother is eating, what nutrition she's getting, what's transferred to the embryo is of importance here. There are no genetically transmitted birth defects. I'm going to repeat that. There are no genetically transmitted birth defects. On the other hand, all birth defects are caused by nutritional deficiencies of the embryo. Of course, birth defects tend to be more catastrophic when you have multiple births, or multiple embryos, where you have a pregnancy with triplets and triplets and twins embryos, because the mother only takes in nutrition for one. And most women do not even take in prenatal vitamins until they miss 2 or 3 periods. So the embryo is already damaged. And again, we're talking about cleft palate, cerebral palsy, problems with the eyes, cleft palate, things like, muscular dystrophy and cystic fibrosis. They're kind of interesting because both of those are caused by nutritional deficiencies. But they are repairable even after the baby's born because it's a biochemical thing as opposed to a physical change. Okay? Type 1 diabetes is a birth defect. It's caused by a nutritional deficiency of the pancreas when it's forming in the early stages of the embryonic development. And the beta cells in the islets of Langerhans, which produce the insulin, instead of having 500,000 per islet of Langerhans, might only have 50. Not enough insulin, and so you wind up with a type 1 diabetic. Same way with sickle cell anemia. Sickle cell anemia is not genetic. This is a birth defect of the bone marrow, which then produces only dysfunctional hemoglobin. And so, we have a way of actually, after the baby's born, you can't totally cure it, per se, but you can encourage more of the normal cells that are in the bone marrow, the red blood cells, to make more of them. Okay, so we do have something that can make things better, right? I think much better than the drug approach to sickle cell anemia. And, of course, you have trisomy 21, which is Down syndrome. All right, these are all things that are caused by nutritional deficiencies of the embryo. Yeah, even Down syndrome is caused by a nutritional deficiency. It's kind of interesting. I've been able to reverse Down syndrome, diagnosed in the embryo 2.5 months of age in pregnancy. And this was done by amniocentesis, where they took fluid from the pregnant uterus. And were able to see the trisomy 21, the 21 chromosomes, which cause Down syndrome. And then, of course, they actually did an ultrasound, high-resolution ultrasound, so they could actually see the facial changes in the baby, which again confirmed it was a Down syndrome baby. And by changing the mother's diet and giving it all 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, the Down syndrome was reversed in the embryo, and the baby's born perfectly normal. Now, I have to share with you, this is a very famous person. Okay, Lauren Knievel, Evel Knievel's niece-in-law. Okay, so this was not a quiet thing. This is this information was shipped around the world many times, and so people know about this, and yet there are still OBGYNs that do not tell women, listen, you're in the childbearing years, I don't care if you don't think you're going to get pregnant, to protect any embryo, you need to be taking the 90 essential nutrients. There are no OBGYNs who do that. As a result, the birth defect rate is skyrocketing. We're seeing all kinds of new birth defects we've hardly seen before. We've seen more and more psychoptic babies with one eye in the middle of the forehead. We see microencephaly. You may remember a year ago, there was like 600 women on the East Coast who were pregnant in the early stages of pregnancy, and they had the Zika virus infection. Everybody was throwing up their hands and screaming and wailing that all these babies are going to be born with microencephaly. You haven't heard anything about it a year later, because I don't think many or any of those babies who were born to these women who were infected with the Zika virus were born with microencephaly, because I think microencephaly is a nutritional deficiency. We know that hypervitaminosis A can cause, it's a bell-shaped curve, that can also cause things like microencephaly. So it's one of these things where we have all kinds of limb defects, genital defects. You get babies that are born, they're hermaphrodites that have both parts, That's a nutritional deficiency. That's not genetic. And then you have babies that have all the equipment of boys and girls, XXX females and XXY males, right? And they still, the one with the boy chromosomes and the boy equipment between his legs, still want to be a girl. That's not a choice. It is a congenital event of the preoptic hypothalamus. Totally preventable. We'll be back with Dead Doctors Don't Lie for these minutes.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us on the priority line. We do have some open lines. You'll be able to get straight in. That number is 831-685-1080. That's 831-685-1080. Lines open. Aromatherapy oils have been prized by ancient cultures for thousands of years. Longevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation. Longevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many ancient legacy oils come directly from families in the East which have been distilling essential oils for over 100 years. Keep Ancient Legacy's tea tree oil in your medicine chest for first aid. Tea tree oil is great for soothing the itching and stinging associated with insect bites, burns, scrapes, and other skin irritations. It's also effective as an antiseptic. To learn more about aromatherapy and essential oils, contact your local Longevity associate today. And don't forget to ask about business opportunities.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it, too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach for Youngevity in 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. And, again, that's toll-free, 1-888-379-2552. And don't forget our priority line, 831-685-1080. The priority line is 831-685-1080. I want to stay on this pre-existing conditions just a little bit here, because as part of that, of course, the prediction is by the government that our children will be the first generation of Americans that do not live as long as their parents. So I want you to contact your Youngevity associate and get a hold of the books, Dead Doctors Don't Lie, get a hold of the CD, DVD, Dead Doctors Don't Lie, get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, get a hold of the DVD called Somebody Needs to Go to Jail, and get a hold of the CD, which is called Public Enemy Number 1. Then Rare Earth Bin Cures, the book. And, of course, you want to get a hold of What Kills Billionaires and Dead Athletes Don't Lie. Oh, it wouldn't hurt to throw in my new CD, A Stick of Butter Day Keeps the Doctor Away, and learn how to protect the embryos before they get pregnant. And then you won't be a grandparent babysitting a catastrophically injured embryo or baby. Okay, this is something we can prevent, but we have to do this because the OB-GYNs have failed us, the medical system has failed us, the government has failed us, so it's time to take this in our hands. Call your Youngevity associate, get a hold of the books, Dead Doctors Don't Lie, Epigenetics, and Rare Earth Bin Cures. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about breastfeeding, as you always recommend breastfeeding as a good way to go for women who are, having children, and because of all the nutrients that they get that they don't get in these formulas. Well, yet another reason why women should consider breastfeeding when they have a child is there's a study out that found that breastfeeding is linked to a lower risk of endometrial cancer. An analysis of 17 studies suggests that while breastfeeding is for any kind of time at all will reduce the risk of endometrial cancer, and those who fed for the recommended 6 months lowered their risk even further. They say surpassing the 6 to 9 month recommended time frame did not have any extra benefit, they said, but those who had ever breastfed their children were 11% less likely than women who had children but didn't breastfeed at all to being diagnosed with endometrial cancer. The lead author, Susan Jordan of the QIMR Bighofer Medical Research Institute in Australia, says cancer of the uterus is becoming more common and we need to try to prevent it. The more women know about the things they can do to reduce their risks of future cancer diagnosis, the better. And they go on to say the report, which was published in the Obstetrics and Gynecology, and they used research that was compiled in the Endometrial Cancer Consortium, including 10 from the United States, others from Canada, China, Europe, and Australia. And they looked at more than 26,000 women who had ever had a child, whether they breastfed and for how long. Among the women, researchers discovered that about 9,000 had been diagnosed with endometrial cancer after accounting for other risk factors such as age, education, race, oral contraceptive use, menstrual status, years since the last pregnancy, and body mass index. They suggested the protective benefit for breastfeeding still remained, and they noted that the study didn't prove that it actually protects against endometrial cancer, but they said it was possible that the estrogen, which stimulates the growth of cancer, is suppressed during breastfeeding. I found that interesting.
Yeah, it's very interesting. Of course, it's also true that about 10 years ago, India, the country of India, did a study on breastfeeding women versus women who fed their newborn babies with formulas. They found that the women who fed their babies with formulas instead of breastfeeding had the highest rate of sudden infant death syndrome, crib death, and the women who breastfed had almost no crib deaths. There's a big study in India, and of course, this is one of the reasons why we fought so hard in federal court to get selenium into the formulas, baby formulas, and we were successful as of January of this year. These baby formulas were supposed to have selenium in the formulas, now which none of them had trace mineral selenium, and this will not only reduce the risk of sudden infant death syndrome, aka crib death, but also reduce the risk of cystic fibrosis and muscular dystrophy. So we're really proud of that, and thank you for bringing that up. There's all kinds of benefits to breastfeeding of babies, and I encourage everybody to do that. But don't forget, you need to supplement the nutrients that come through the breast milk into the baby. Avoid the bad stuff, so the bad things won't come through the breast milk into the baby. And we'll be back with Dead Doctors Don't Lie after these messages.
And we do have some open lines. If you've ever had trouble getting into the show, today is your day, as we do have open lines on the priority line, 831-685-1080. That's 831-685-1080. Lines open. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Youngevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And you want to get in directly, give us a call on the priority line, 831-685-1080. That's the priority line, 831-685-1080. And if you're going to do the Youngevity business as a business and actually get paid, get tax breaks like the billionaires, or helping other people with the information and guiding them through so they can help themselves with their health issues, contact your Youngevity associate and ask for the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. That's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. In the book, Let's Play Doctor, will teach you how to do a physical using the same test strips as the doctor. You can go to a pharmacy, get the test strips without a prescription, And the doctor will charge you $2,000 for that physical, charge your insurance company. You can do the same physical for $4.50. Do it yourself. And, of course, if you've never been profitable in a business, if you've never run your own business, if you've never run anybody else's business on the financial side, you need to get a hold of the book Wall Street for Kids and learn how to deal with being profitable, learn how to get the tax breaks that billionaires get. We don't want to take away their tax breaks. We want to get their tax breaks. You cannot do that as an employee. But at the very least, you need to do the longevity business part-time, and you get the same tax breaks. That's right. You get the same tax breaks as a billionaire, even if you're only doing the longevity business part-time. And then, of course, you can actually make your monthly premiums for health care, monthly premiums for life insurance, monthly fees for your fitness center, your monthly fees to qualify in longevity, to get a check from longevity. You can put out all that into your business plan, okay, that you'll learn about in Wall Street for Kids, in the book Wall Street for Kids, and you'll learn how to put all that stuff in your business plan so that all that stuff becomes tax deductible. Just pay it out of your own pocket, it's not tax deductible. If you pay it through your longevity business as part of the benefits your company gives you, just like other big corporations gives benefits to employees, those are tax deductible. They don't do that just because they're nicey nice. They do that primarily to get tax deductions, and of course, as a kind of a nice side effect, your employers are happier. Okay, with all that said, Doug, let's go to callers.
All right, let's head to New Jersey. And Jennifer, you're on with Dr. Wallach.
Hello, Jennifer, you're on the air. Hello, Jennifer.
Yes, sir. I'm here.
Yeah,
How are you,
speak
Doctor?
up a little bit. Okay, that's better. Thank you. How can I help you?
I would like to ask a couple of questions about my mom. She's a diabetic. She has high blood pressure. The pressure won't go down. She takes an insulin. She's on dialysis. And ever since she's been on dialysis, she's been losing weight rapidly.
Okay, what does she weigh now?
She's about 85 pounds now.
Okay, and how tall is she, you think?
She's about 5'5".
5'5". Well, she's very thin, isn't she?
Yeah, she is, and she's worried about it.
Okay. Let's see if we can help her out here. This is a pretty straightforward thing. And, of course, you have to appreciate it. Is she type 2 diabetic or type 1?
She's at that, I don't know, I think she's type 2. She's taking an insulin now.
Okay, so adult onset. Okay. Okay.
Yeah.
Does she have any other issues? Does she have arthritis or anything like that? Okay, well, hang on here, Jennifer. We'll be back, and Char and I will give you some suggestions after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you've ever had trouble getting into the show, I've had people complaining to me that they can't get in for weeks. Today's your day. We do have some open lines. Call us at 831-685-1080. That's 831-685-1080. Lines open. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
This is the ZBS Radio Network.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 95 State. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And we also have the priority line open, 831-685-1080. That's 831-685-1080. And let's see here. If you need to lose that 10, 25, 50, 75, 100 pounds or more, contact your Youngevity associate and ask for the books Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome. Excuse me. And then you also need to get a hold of the book Energy Crisis and learn about the keto diet. Okay, we actually have a pre-fat keto diet for you. The keto caramel shake, a meal replacer, the keto caramel bar, a meal replacer. So you don't have to cook and weigh and calculate and do all kind of stuff. It's already pre-done for you. You should have 2 meals a day, either a combination of the keto caramel shake and or the keto caramel bar. You can have one at breakfast, one at dinner. You can have both the same one day and both the same the next day kind of thing. And then don't forget the healthy weight loss pack, 1 per 100 pounds of body weight. You'll lose a half a pound to 2 pounds a day. And the magic is you'll never gain the weight back as long as you stay on the 90 for life. And the reason is, of course, weight loss and weight gain. Weight gain has nothing to do with eating too much or lack of exercise. Okay, it's actually due to nutritional deficiencies. That's why I need to read the book, Hell's Kitchen, An Energy Crisis, so you understand how nutritional deficiencies can cause you to gain weight and become obese. Okay, Doug, let's go back to New Jersey and Jennifer. Okay, Char.
Yes.
Jennifer's not her mom. She's 5'5", only 85 pounds, very skinny. She's losing weight. She's on dialysis. How long has she been on dialysis, Jennifer?
About 9 months now.
Okay. And so what, about 3 times a week?
Yes.
Okay. And, of course, that's a contributor to, could be the cause of the high blood pressure. Okay. And I'm assuming she's on high blood pressure medication also?
Yes, yes, sir. Yes.
He's still not responding real well. Is that correct?
No. And it's been for a while now.
And so, no, she's not responding. Is that correct?
No, she's not responding.
Okay. All right. So, Charmaine, what would you do? What's going on here? Why is it these medications are not helping her with the high blood pressure?
Well, because when she takes the high blood pressure medicine, her kidneys release a hormone called renin that raises her blood pressure back up because they want to get dirty blood to clean, and they're not getting it.
Yeah, so they're trying to force the blood pressure to go drive blood into the kidneys, so as you say, it can filter the blood.
Right.
Okay, and let's see, what would you do for her? She weighs 85 pounds. She's got type 2 diabetes. And so what would you do for her for the blood pressure, the dialysis, and the diabetes?
I would, for blood sugar problems and high blood pressure problems and the dialysis problems, I would get her on one Healthy Brain and Heart Pack, the Ultimate Daily Classic for the dialysis, and the Sweeties for the diabetes.
Okay. Yeah, basically what you're saying here is, and I would give her a basic program here. I would go ahead, because you got all these things going on, I'd give her one Healthy Brain and Heart Pack per month, one Healthy Brain and Heart Pack per month. I'd give her 2 bottles of the Sweeties per month, so she could have 3 of the Sweeties at breakfast and 3 at dinner, or 2 at breakfast, 2 at lunch, 2 at dinner. They're to support and promote healthy blood sugar levels, to support and promote healthy sugar and carbohydrate and fiber metabolism at the cellular level. And then, what would you throw in again for the blood pressure?
Well, I would give her the Ultimate Daily Classic.
Very, very good. Yep. I'd go ahead and get her 2 of the bottles of the Ultimate Daily Classic to support healthy blood pressure and healthy blood flow through obstructed arteries. Because when you have kidney failure, most of the time there's nothing wrong with your kidneys, but the blood vessels carrying the dirty blood into the kidney are plugged, so they can't get filtered. And stick with us. We'll be back after these messages.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it, too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back. Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 90 for Life Crusade. We do have lines open. Give us a call, toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. Or call the priority line, 831-685-1080. That's 831-685-1080. Just quickly here to finish up with Jennifer's mom. Let's see here. Also, on the Ultimate Daily Classic tablets, I'd get her 2 bottles a month, so she could take 6 of those a day. 2 at breakfast, 2 at lunch, 2 at dinner time. And they're designed, again, to support healthy blood pressure and healthy blood flow through plugged arteries, obstructed arteries. And then what would you do, Char, to help her maintain or maybe even gain some weight back in a healthful way? What would you give her to accomplish that?
I would give her the whey shakes only made with whipping cream and put egg in it.
You get an A+. You get an A+ there, dear. Yep, we give her the shake from Longevity, which is the whey shake. It's also called Slender Effects, is the name of it. And, of course, instead of making it with water, which would be a weight loss thing, which you don't want, you make it either with half and half or heavy whipping cream, as Shar says, and then throw in maybe 2 or 3 eggs and do that twice a day. And you'll be able to get some good, high-quality protein and good fats in her and so forth. And that will perhaps help her maintain, or at least maintain her goal here is to help her gain another 15, 20 pounds or so forth, so we can't get all that done. Call us every 2 weeks. Let us know her blood pressure levels. Let us know her blood sugar levels. Let us know her weight, and see how her energy is doing and her emotional status and so forth. Okay, Doug, let's go to another caller.
All right, let's head to Michigan. And Dave, you are on with Dr. Wallach.
Dave, you're on the air. How you doing, buddy?
Good. How you doing, Doc?
Okay, sir. What's going on?
Well, I know I'm a couple days early, but happy birthday to you. Happy birthday to you. Happy birthday, Doc Wallach. Happy birthday to you, and many more.
Oh, thank you very much. That's very kind. And,
you're welcome.
You kind of set this up here. It's a surprise to me that anybody knew that, but thank you so much. And, of course, if you use the Chinese method of aging, which starts when you're conceived, not when you're born. So you start out when you're born, you're already 9 months old, according to the Chinese method. And so as of today, that would mean I'm going to be 78 years old. If you use the American way of aging, you start your clock of age when you're born, 77. And anywhere, somewhere between 2 and 3 years, I'm going to be 80 years old and have never had any surgery, never any prescription drugs, and I don't have any health challenges. I don't have any pre-existing conditions. If I do get a little respiratory thing because I fly a lot and all these kids are on there hacking and coughing on the airplanes and closed air systems, I have it for about 3 days and it's gone. And so this is because I've been taking the 90 essential nutrients twice a day for 74 years. And so I never fail. And, of course, you've seen me eat. We've been together at events and so forth. Shars see me eat breakfast and dinners and lunches and so forth. And I always take my 90 essential nutrients twice a day. I have never failed for 74 years. And my goal is to live to be 200. And people kind of snicker at that a little bit, Dave, and laugh and giggle. So you must be sniffing glue, Wallach. You're going to live to be 200, right? Well, that's what they told Roger. Roger, the guy who broke the 4-minute mile. Roger Bannister. There you go, Roger Bannister. And nobody's ever done it. And they said that people could not break the 4-minute mile. Only 4-legged horses and dogs, like greyhounds, could break the 4-minute mile. But Roger Bannister did it. The record up until that point was 4 minutes and 23 seconds. In 1954, he was going for the Olympics. He worked in England, okay, and in Oxford University, and he was a professor there. I don't remember whether it was economics or something like that, or literature, one of those sort of things. And he'd been a track star, and he knew he could break that record. So he had the Olympic Committee send a couple of referees to the tryouts there in Oxford, England, and they were there, the officials from the the Olympics, and they were able to say that 3 of them said that he broke the record. It was 3 minutes and 59 seconds. So he dropped the record by 24 seconds. It's almost a half a minute, which is just like outstanding. And so our hats off to Roger Bannister. But the next year, thousands of people broke the record because they knew it could be done. They put out that extra effort. And today, if you're going to try and get on a team and run the middle distance, you better be able to break the 4-minute mile. Otherwise, you're wasting your time staying in line because so many people can break the 4-minute mile now. And so I believe we can, taking the 90 essential nutrients faithfully, obsessively, twice a day according to her body weight, and avoiding all the bad foods because you cannot out-supplement a bad diet. You know, Char, you've been taking the 90 cents of nutrients for how long? How many years?
Over 26 years.
Over 26 years. And do you have any health problems?
Not that I know of, no.
And no, you just turned earlier this year. I think it was April 7th. You turned 74.
Yep.
Is that correct?
That's correct.
You turned 74, and most people think you're 40. And okay, and so I just want to thank you again, Dave, and thank you, Char, for making this work. Okay, we do have some.
Doc, can I give a little testimonial?
Well, let's see here. If it's short,
do we have time?
Make it 2 minutes or less.
Okay, so I've been on the 90 for since about 2011, and I needed both my knees replaced. I had broken my right leg back in 1979 twice, and I had this crack in my shin bone 10 inches long. It was about a half-inch deep and a half-inch wide, and that has filled in. After 35 years, that crack filled in. It's gone.
How about your knees?
My knees are. I still got my knees. In 2012, I fell down the stairs and shattered my talus bone. They said I had an 80% chance I'd have to have that foot amputated, and I'm walking about well, I'm on the treadmill. I'm not getting my foot amputated, and yep, I lost about 100 pounds, and I owe it all to you, Doc, and your brilliance. And
well, thank you.
Your
You're very kind. We got to
formulations.
run here now. Thank you,
Thank
Dave.
you.
Call again, and we'll go over some more. But great testimony. I love seeing you, and people love seeing you at all the events. Okay, Doug, let's go to callers.
Let's head to Gainesville, Florida, and Mariah, you're on with Dr. Wallach.
Hello, Mariah. You're on the air.
Hi, Dr. Wallach.
Hi. How can we help you?
Well, I have a number of situations, starting with diabetes, and it has given me, I suppose, fibromyalgia, which has been very painful for a long time. Also,
Okay, you said you have. Wait a minute. You said you had diabetes.
Yes, diabetes
Okay,
too.
you have fibromyalgia.
Yes.
How much do you weigh, Mariah?
About 85.
And how tall are you?
I used to be 5'4", and now I am 5'2". I have lost like 1/3 of my body weight in the last year.
Okay. All right. Anything else going on we need to know about? High blood pressure? Anything else?
No blood pressure, osteoarthritis. My knees are inflamed, and lower back.
Okay. Now hang on. We're going to have to run one of those message moments. And Char and I will be back. Get your pen and paper ready, Mariah, because we're going to give you something to do here to help you out. We'll be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. When those aches and pains in your knees, elbows, hands, shoulders, and back crop up, reach for Youngevity's CM Cream. Put CM Cream on a Q-tip and put it in your ear canal for relief from headaches and sinus pressure. A topical temporary relief from minor aches and pains of muscles and joints associated with strains, sprains, and simple backaches. Why take aspirin or non-steroidal anti-inflammatory drugs that can cause stomach bleeding and liver damage? Just apply CM Cream liberally to the affected areas, and within 20 minutes or so, you'll have relief from those nagging minor aches and pains. You'll feel better for up to 4 to 5 hours. So the next time you have achy joints or muscles, do what I do. Reach for CM Cream for relief. And for systemic relief, reach for CM Plus capsules. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate. And don't forget to ask about home-based business opportunities.
Hello, Judy DeVilbus here. if I could only afford to get one product out of everything, that product would be the ultimate classic. It has the vitamins, the minerals, the bioflavonoids. It even has grapeseed extract. The one product that would give you just about everything under the sun you would need for a perfect nutritional program would be the ultimate classic. By the way, people that are on the go, it's very, very hard to take the liquids with them when they go on their trip to get their supplements in every day. Well, you know something? You can use the Ultimate Daily tablets and the mineral capsules. When I'm going on a trip, if I have enough room, I just take the 2 bottles with me. If not, just use a little baggie and take a couple of daily doses with you. It's very simple. It's very easy. There's no mess, no fuss, no refrigeration. Just take your capsules, take your tablets, and you're finished for the day.
To order these products, call your local Youngevity distributor today. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie, the ZBS Radio Network. Dr. Joel Wallach here for Youngevity 95 Crusade. And let's see here, Doug, let's go right back to Florida and Mariah. Okay, Shar, Mariah's got knee problems, back problems, type 2 diabetes, and fibromyalgia, which kind of goes along with the knee and back stuff. And she only weighs 85 pounds, about 10 pounds lighter than you. So what would you do for her? What would you suggest she start on?
Well, for her blood sugar problems, I would get her on a healthy blood sugar pack, and then I would add the glucogel for her arthritis.
Okay, and let's see here, the arthritis. Okay, and what else would you add?
I don't know, HGH.
No, I would go for something on stem cells. Stem cells. To support stem cells, I would give her the Immortalium. Well, there you go. Now you get an A+. Okay, so I'd go ahead and give her. One healthy brain and heart pack, half a dose of everything twice a day. I'd go ahead and get her 2 bottles of the glucogel, so she could take 15 a day, 5 at breakfast, lunch, and dinner. I'd get her 2 bottles of the Sweeties, so she could take 3 twice a day or 2 3 times a day, support healthy blood sugar. And the fibromyalgia, of course, I'd throw in the, which one? What is that again? Immortalium? Yeah,
Immortalium.
Yeah. I'd go ahead and give her 2 of those twice a day to encourage stem cells to make what they're supposed to make. And in the case of fibromyalgia, we're talking about cartilage, ligaments, tendons, connective tissue, muscles, all this kind of stuff. And then, Mariah, please call us every 2 weeks. Let us know how you're doing. You can start the diet immediately. It might take 5 to 7 days, working days, to get the product from the West Coast if they're going to ship it from the West Coast to you. But you can start the diet immediately. No bad foods, no fried foods, no processed meats, no oils, no gluten, no carbonated drinks. Okay, Doug, how much time we got?
You got about 3 minutes.
Oh, okay. We got time for another one?
Yeah, let's head to Fontana, California. And Laura, you're on with Dr. Wallach.
Oh, Laura, you're on the air.
Hi, Dr. Wallach. Yes, I was wondering if you could help me out with something here. It's my husband was just diagnosed with AV2 block, and so they're talking about doing a pacemaker. And I was wondering if there is anything natural that can be done.
Okay, now, let me ask you, did your husband have a back problem?
A back problem? No, but he does have cancer. He has bile duct cancer, colon cancer, and possibly prostate cancer. And he's 5'11", and he's only weighs about 105 right now.
Okay. We've got some serious issues here. And so are all these cancers from the same origin, or are these three individual separate cancers?
They believe they're 3 primary cancers.
Okay. All right. Excuse me. All right. So the AV block, okay, could be due to back problems. Do you know if he has any metastasis from any of these cancers into his spine or his bones?
Not that we've been told as of yet. No.
Okay. All right. Because sometimes you can have an issue with the nerves being squeezed in the upper 4 thoracic vertebrae, T1, 2, 3, and 4, the roots of the nerves being squeezed, and it results in things like atrial fibrillation, ventricular tachycardia, all this kind of stuff, and it's really not it's a back problem rather than a heart problem. Okay, so we only got a minute or two here, Sharp. How much does your husband weigh, Laura?
105.
105, okay. There you go, 105. I didn't write that down. I apologize. Okay, and 5'11", he's probably 60 pounds shy here, very slim. Okay, so what would you do for him, Shar, to support his immune system, which is your best friend, your immune system, your best friend when you have cancer?
I would get him on a healthy brain and heart pack, and I'd also get him on all the, he needs auric points, over 100,000 auric points a day, which would be the ultimate daily tablets.
Okay.
The BTT 2.0 tablets. And then I would also, if he, I would take the Ocean's Gold, the Fucoid Z or the Z Radical, and take the whey shakes with the whipped cream to gain weight.
There you go. And so, give us a call, and we'll tell you about dosage. You should be able to get the products that Char laid out for you within a day or 2 working days because you're in California. And, you want to support the immune system, get those work points above 100,000, get rid of all the bad foods which cause the cancers. Thank you, everybody. Great testimonies. Thank you, Dave and the Thumb, for the birthday announcement. And thank you so much, Char. Super job. Thank you, Doug and Sam, super job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.